Today, we're excited to welcome Stacey Strilchuk, principal owner of SLS Healthcare Consulting, for an engaging session on how local leaders can build stronger, healthier communities through effective advocacy. With over 30 years of leadership experience across Alberta's healthcare, government, and nonprofit sectors, Stacey brings a wealth of insight into the power of advocacy in rural healthcare. She'll share practical strategies to help you build meaningful partnerships, communicate effectively, engage your community, and measure your impact. So without further ado, I'm going to change it over to you, Stacey.
Thank you so much, Chandra. And good morning, everyone. I want to first off note that I'm so appreciative and thankful for the opportunity to be with you today. And I want to thank RhPAP, their board, Tracy, and of course, Chandra and Emily for supporting me in this conversation today. And most importantly, I want to thank you for taking time out of your busy day and schedule to just come and be part of this conversation. This is near and dear to my heart with respect to community advocacy, particularly in the healthcare space. And so today I really want this to be more of a conversation. We're going to share, and I'm going to share some stories, not to illustrate sort of what to do, but to start to allow you to be creative and think a little bit about what you can do individually and collectively in your communities. And so we're going to walk through a few themes today. I'm going to share some stories, and then we're going to have some time for questions and conversation. But having said all that, it's important for me to, again, note that it's a privilege to be in this space and have this conversation with you today. And the conversation doesn't end here. I'm always willing to have these types of conversations wherever they may be, and whatever works best for you. So with that, Emily has been gracious enough to say that she'll help with the slide sharing and today. So with that, Emily, if I could ask you just to share the next slide. I too want to just offer a land acknowledgement, and I respectfully acknowledge that I'm on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples. More importantly, I want to recognize and thank all the elders and knowledge keepers and colleagues that have helped me in my journey as I commit to building and nurturing those authentic relationships. I could not do these things without them. And I'm always so appreciative of their time, their ability to help me seek to understand, and the patience they show as I listen and learn. So thank you for that. So topics that we're going to explore today, and we're not going to specifically go through each one of these line by line, but I hope that by the end of our conversation today, you'll start to see some themes coming to shape around, the role of advocacy, building partnerships, some conversation about communication and engagement, and measuring impact. And what I'll say to this is, there is no right answer. There is not a recipe here for success that I'm going to share with you today that you can take back tomorrow and implement for the next day, the next week, the next year. This is work that I consider to be sort of a living, breathing journey, and one that changes over time and makes us be nimble and flexible. But what I will say in this is that part of my learnings in this particular space is just understanding and starting to be comfortable being uncomfortable. When we're able to do that, when we're able to seek to understand, when we're able to use, the philosophy of 2 ears and 1 mouth for the purpose of really being intentional in our listening, I think that a lot of these topics and themes start to gain some clarity. And so while I'm going to share today is sort of my journey, each of you have your own journey, and it's important to be respectful of that. And so moving along, we're just going to share in the next few slides. I'd just like to share some definitions so that we're all sort of starting from the same space. And I think many of us sometimes use these words interchangeably. And so I want to make sure that, I give some opportunity to sort of my thoughts on each, and let you, more importantly, start to think a little bit about where you what resonates with you, and where you see yourself in this space. So, oftentimes lobbying and advocacy sometimes are used interchangeably. Each have its own sort of pathway or road. Uh, but where I like to play, and where my sandbox is, and where I feel that I can add the most value, is certainly in the space for advocacy. Um, there's a phrase that's been starting to be used now a little bit more often in some of the work that I do, and it's called, putting the fish on the table. And when we put the fish on the table, it means that, we're in a safe space, and we're not scared to sort of challenge ourselves on some of the challenging uh, activities that are going on right now in our world, and in particular in healthcare. And I think it's important for us to put the fish on the table and say that we are in a space of change. And with the restructuring of healthcare in Alberta, there are a lot of questions being asked, not maybe a lot of answers yet. There may be, differing opinions. There may be some conflicting priorities. But where I think we land on this is when we put the fish on the table and we're willing to acknowledge that, those conversations start to happen in a way that are much more constructive and robust. And so when we are in situations like this, I think it is important to acknowledge that times right now in Alberta for healthcare are a little bit worrisome for most people. This restructuring will take time. Uh, it is not just a traditional change management discussion that we can have. There will be differences, there will be bias, and I think it's important for us to care for one another, and in the same breath, give each other space and time uh, to take this in, and to digest it in a way that makes sense for them, and to honor that. So being a little bit more prescriptive on local advocacy, and I think this is where I'm going to start to show my bias. Um, where I see myself playing a role for the last 5 to 6 years is uh, trying to be a good system convener. And oftentimes what I'm hearing in communities, and particularly in communities that I work in, which is rural and remote, is that communities are saying to me, we may not necessarily have the money or the intention to have an official government relations group or a lobbyist group, but we still want and seek to understand information, right? We still want to understand sort of what the vision is of the ministry, how the department is working through policy and regulation, how that might impact our community. And so there is this desire to understand that. Um, but I'm also hearing that uh, a community, and I believe this, a community knows their community. They don't necessarily need to have somebody come and tell them about their community. And so the space that I play in is certainly one that I feel is kind of in the middle, right? It's where I sit, where I can go to my sort of government contacts, my colleagues, to ask a question, whether it be for my own interest and knowledge or asking on behalf of a client, and then taking that information and having that conversation with the client where I'm hoping that I can help make it relatable to their community and to their desires and their wants and their needs, and to then really start to be able to have a constructive conversation on how do we advocate for the community, for individuals, for families, for caregivers. How can we use that voice, right, to be good champions? And it's important for me to always look for ways to speak the truth, to be evidence-based, and it's okay to make sure that we're sort of overlaying that with the lens of shared values and beliefs. And then again, helping the community and helping leaders understand that decisions have impacts and what that might look like, trying to understand the risks, but also looking at how we will be able to celebrate those successes when they do come. And so I take my role as system convener very seriously. And I certainly appreciate another role that sometimes I'm labeled with, which is a shift disturber. And I also take that very seriously. So again, I think I'm going to start, you'll start to see a bit of a trend here on my bias when I start to talk about some of these definitions in healthcare, and particularly healthcare, primary care, and primary healthcare. And so I just want to offer as a framework sort of what each one and its important role, what it plays in your community. I I think that the fun fact here for me to share is that I separate the word health with care. I separate the word with primary with care. And I do that because I want to accentuate the word care, because it doesn't matter if we're talking and using a definition of healthcare, so that broader term for diagnosis and treatment, or we're talking about primary care, which is again kind of starting to reduce it to that first point of contact for those that are kind of seeking that health service. Or now, as we move to the next slide, where we talk about primary health care, right? Where now we start to broaden that out in terms where we start focusing on wellness. We start talking about community supports. And we use terms and language that you may be familiar with, which include things like a medical home, a medical neighborhood. And now the term, I think, that's starting to resonate a little bit more with individuals and communities is an integrated health hub. And I think that regardless of the conversation of what pillar we're trying to advocate within, so if it is in primary care, or it may be in now continuing care, or it may be in recovery care with addiction and mental health, or it may be in acute care, I think that care continues to sort of be our grounding foundation, as well as terms that we're starting to use now around team-based care and offering the connection to social determinants of health. So I did want to take a few minutes just to speak to those terms, because we could spend days talking about advocacy in the healthcare space throughout all the pillars. But because we don't have that time, I wanted to bring in one example and speak to my experience within the primary healthcare space, but certainly knowing that we can apply that to other pillars of health. So again, primary healthcare, it is, in my opinion, the foundation of a thriving community. It does offer opportunity to have multiple providers drawing on their expertise and working together. And it's a recognition really of quality of life. And it's got influences on your economic and cultural situations and your spiritual beliefs. I sometimes get the question around how does this, how do I play a part in primary healthcare, right? I have municipal leaders, I have some healthcare professionals. I have key stakeholders that will come and ask that question around, well, I don't see myself being part of primary healthcare, or I don't see how I can add value to primary healthcare. I think everybody has a role to play in primary healthcare, and I base this on a couple examples, and I'll share these quickly. My grandmother was a fantastic. She was a fantastic woman, but her superpower was her ability to cook. And when she left the rural community that she was living in, when my grandfather passed and moved to Edmonton, she was seeking ways to add value to the community. and didn't want to necessarily be what she would say to me, a burden on society. And I remember a story where she said, they were offering me a widow's pension, and I felt that it was a handout versus a hand up. And so I didn't want to take that. And the next day, she walked 4 blocks to a continuing care center and asked if they needed somebody to help in the kitchen. And from there, she became sort of this uh, foundation in the continuing care center, where everybody knew that Mary, my grandmother, was a cook in this facility. And over time, not only did the staff know that she was a cook in that facility, the residents certainly knew that she was a cook in that facility. And all of a sudden, a lot of extended family also knew that she was a cook in this facility. And we would have conversations about her impact on that community in the continuing care facility, and really, in my opinion, her impact on primary health care. She not only was there, you know, seeking ways to provide good quality food for the residents in the continuing care home, but she was also bringing families together. Oftentimes, I would hear that on occasions where it would be Easter or a holiday event where families would come, the dining room would be full, absolutely full, to the point where they would have to start making reservations because they knew that Mary was cooking, and it was bringing families coming there to spend time with their loved ones because of that. And so I offer that again as sometimes we need to shift our mindset a little bit and recognize where we can influence the health and the wellness and the quality of life of individuals and families and communities within our own situation and our own environment. It doesn't need to be in a box of primary health care. It doesn't need to be in a box of a traditional clinic or facility. It does give you opportunity and a runway to really be attached and to really influence your own community in a variety of ways. And so that's why I believe so much in primary health care, and in particularly in rural and remote areas. So I wanted to offer just a little bit of where I'm kind of seeing the state of primary healthcare in our communities, and what you perhaps can start to look for a little bit when you're having these conversations. And these are, not an exhausted list, but ones that I think that come up on a regular basis, that happen in conversations with your family, with your friends, with your colleagues, at potentially leadership tables or community gatherings. And the big one that I think I want to speak to is the local health indicator information that is available to communities. And I think that this is such again, a foundation for building good evidence as to answering your why, right? Why are you wanting to do this work? Why are you wanting to be a good advocate? Why are you wanting to be a good champion? And one of the things that we did in the Camrose catchment area, that catchment area covered almost 30,000 patients, individuals. We had cities, we had towns, villages, hamlets. It covered 3 counties, and it was so intentional and so purposeful for me and important for me to go out to meet with individuals, whether it be at a service club, a town hall, municipal gathering, a municipal leadership gathering, whether it be at a council meeting or some type of a community event where we could have conversation about local health indicators. And those things were really insightful for me, because I started to be able to align sort of the evidence that was being given to me through some of the data collection and analysis that was being done at the provincial level, talking about things like, what was the age range of that catchment area or that particular catchment area or community? What were some of the chronic health conditions that community was facing? Could we have a good conversation about, does this resonate with you? Do you see the the impact that this is having in your community? And if we could, then that would allow us to start to generate some ideas with respect to how could we offer programs and services that weren't necessarily traditionally related to healthcare and healthcare professions, but what could we do in our community ourselves to sort of support some of the health indicators that were being identified to us. And so, for example, in our catchment area, smoking cessation was high. It was tobacco use was high, and we were looking at ways to do smoking cessation events, screening in certain chronic diseases and certain prevention screenings for cancer screening, for example, was low. We needed to look for ways that we could offer screening opportunities that were unique and impactful for that community. And I think that once we start using that information and using it in a good way, in the sense of sharing it appropriately, listening and learning from the community and the individuals there about what they're hearing and seeing for health indicators, and then collaborating together to come up with ways to have good conversation and good programs and services. And if we needed to advocate to your traditional type of healthcare facilities or leaders, or if we needed to communicate and advocate that to local leadership or decision makers, we had some evidence to support that. And I think that was an important methodology that we used, and it was successful to help advocate for some of the work that we were wanting to do. So I teased this one particular, state of our healthcare out because I do think it's important to recognize that the healthcare disparity piece is something that we need to pay attention to individually and collectively. It is not something for us to be shying away from at any point in time. And it does mean that we have to consider factors as race, income, and geographic location. I have had, again, the privilege of working with a number of Indigenous communities and lower income communities where there are factors that make them unique to our system and unique to the ability to actually collaborate and work with them with such a heartful intent, right? And I think every one of us needs to experience being able to be around a table, a sharing circle, to listen and learn, and then to be able to talk about quality healthcare services in a different way. You will hear the government talk a little bit now more so about population health data, population health services, and this is stemming from health inequities and wanting to pay attention to that. And so I do want to recognize that there is work to be done in this space, and it would be prudent for us to pay attention to this and to seek to understand where we can. And there are a number of resources, and there are a number of individuals that are happy to share their experiences so that we can start to be collaborative in our approach to starting to highlight these primary healthcare disparities and our path forward. So again, I always like to go back to the question of why. Why advocate for primary healthcare? And I think all of us and those of you that are joining today are thinking about this question and wanting to figure out and look for ways to be able to advocate for primary health in the primary healthcare space, even if you may not call it primary healthcare. I think that access and inequalities are things that we talk about on a daily basis. But I want to sort of highlight the concept around making communities more resilient and self-sufficient. And we can do that in many different ways around increasing awareness, looking and talking and celebrating about community-based solutions, and then seeking ways to positively make change at the policy and regulation level. And I'll offer a couple I'll offer a couple stories here where I think there was good uptick and a really positive trend in the idea about making communities more resilient and self-sufficient, and looking at different community-based solutions. Uh, the one that I'll mention that I think for me was, and I'll be honest, was a bit of a surprise. Um, we, you know, we were certainly impacted in our community with the Humboldt tragedy. We obviously had a team that played in the Alberta Junior Hockey League. Um, we had deeply rooted connections to minor sports and hockey in general. And when that accident occurred, the community in itself was grieving, and we were looking for opportunities to offer, some ways of gathering and sharing. And so what we thought initially was just, a quick way to start to have this conversation was to offer an opportunity in the afternoon, evening for everyone who wanted to come to be part of this sharing event. And it wasn't formalized. It was simply making sure that we had somebody that we trusted as a grief and bereavement advisor. We invited our colleagues and our friends and our families and our partners that were in our space, but were in our extended space in the community. And we invited certainly the team and the athletes and the coaching staff to just come. And again, it wasn't formalized. It was just an opportunity for us to be together and to share. And our grief and bereavement coordinator was so soft in his approach and his short messaging and offering for people to share if they wanted. And what resulted was this community that quickly became very vulnerable and open and transparent and understanding. And the 3 hours went by quickly. There was no need for us to sort of time manage this or, ask for people to leave or stay, or it was just organically an event that happened. And we saw coaches be vulnerable and share. We saw athletes be vulnerable and share. We saw community members that had been, host families be vulnerable and share. And we just let that happen. And it was interesting to me that the days and the weeks that followed from that event, I can say resulted in a much more resilient and self-sufficient community, in the sense that people started to ask questions. They started to seek information, things that seemed a little bit, uh, you know, uh, external for people to talk about, difficult for people to talk about, around grief and bereavement, about death and dying, about palliative and end-of-life care, all of a sudden was normalized. And, we saw such an uptick in individuals asking the questions about programming and services, which I feel are all part of palliative and end-of-life care, is all part of primary health care, and just supporting each other. And so something that, started out with one intention really blossomed into something that was much more, I think I would use the word inclusive for primary healthcare. And so there's an example of, how we advocate for primary healthcare in a different way. and these things just happen. But they need to be identified, acknowledged, talked about, because it is a community-based solution, and it's one that maybe doesn't fit in a box that you would traditionally think is advocating for primary care. The two pieces here around education and raising awareness and collaboration, um, you know, we we I think as leaders, as individuals at the municipality level, at the healthcare leadership level, at the stakeholder community level, we're all leaders. We can all be leaders in some way, shape, or form. And these again, I offer to you is not an exhausted list, right? But ones that I think are tried and true, but yet flexible and nimble enough that you can make them unique to your community. And I think the one thing I will say here is it's important to not be scared to fail. And you're going to learn something from every activity or event or opportunity that you place within this advocacy role for primary healthcare. When I first came to the Camrose community, I too thought it was an excellent idea to consider putting together some type of a healthcare fair for the community. It kind of checked the boxes of sharing information, being collaborative, partnering, looking for a communication tool to spread awareness, all of these things. And honestly, it was an epic fail. And it was one learning that I took away early on in my career as a healthcare leader in that community, to say that not not every idea is a good idea for a certain community, but I owned it and I learned from it, and I went back to the community, and that really was when I started to understand I have to learn. I have to ask the question, what does the community need? What does it want? How can I be a good system convener again in taking some of the knowledge and evidence, but then creating and shaping it into something that's value added for the community? So thank goodness I had a board and I had a network around me that supported my learnings in that, and I was given some constructive feedback, and we were able to move forward. But it's important that you develop a safety net for your community to try these things, but not be scared to fail. And I think constructive conversation and consensus building on some of this work is so important. We initially put our primary care network into the recreation center. And that was that was seen to be something a little bit unique, and not tried before at that time. I think today, 17 years later, it may be more of a commonality, but at that time, it was rare to see that type of an injection into a rec center with medical, or what was considered to be medical partnerships. But it made sense for us, and we advocated for that because we wanted to create a medical neighborhood. We knew that, just 3 doors down from us in the same facility, we had access to a respiratory therapist, physiotherapy, speech pathology. We could offer, a dietitian, a pharmacist, an exercise specialist, registered nurses, social workers. We also knew we had a walking track available to us in the facility. And so when we started to pull all these pieces together, it made sense for us to be there. We advocated strongly to be in that facility. We also had an aquatic center that was right attached to us as well. And so I can tell you that my learnings and my ability to actually listen, right, to understand and listen to individuals, families, caregivers, on what their needs were, what was working, what needed to change, often came from me popping in and spending some time in a sit fit class, or walking down the hall and talking to a group of Aquafit participants that were now sitting and having coffee together. I relished in those opportunities because it helped me understand and helped me communicate, and more importantly, helped me advocate for other partnerships, whether it be with other providers, with schools, for not-for-profits, for local businesses. It just gave me a unique tool in the toolbox to be able to advocate in a different way. I did want to mention this briefly around engaging with decision makers, and I purposefully didn't use language like an MLA or an MP or a counselor or a mayor, because again, I do want to express the importance to me around having everybody sort of understand that there are local decision makers that you can reach out to in your own community and have those conversations and be able to create and develop and implement and measure appropriate models for primary healthcare that will become, long-standing, sustainable opportunities for you that provide good outcomes. It provides good outcomes for an individual, for the community, and at the end of the day, I feel that that is where the efforts need to be placed. I have not had as much success in any of the work that I've done that I've had working at the local level and working with my partners and being collaborative. And that didn't mean that I didn't reach out to my MLA or my MP or other decision makers when it was appropriate. But much of the work that we did, much of the success that we had, much of the outcomes that are still sustainable and existing today came from local decision makers coming together around the table and actually having good, open, transparent, constructive conversations. So engaging with decision makers doesn't necessarily mean moving it up the line. It means more of collaborative, sort of flattening out the decision making into the community where it makes sense. Um, I also think, it's important to be in your community. And when I say that, um, as a leader, uh, look for ways to volunteer or serve uh, with or alongside some of your primary healthcare providers. And that doesn't mean just physicians or nurses. This means going out and maybe volunteering at the food bank, or maybe going out and volunteering and spending time at the women's shelter or another service provider that plays a significant role in primary healthcare. There too, you will start to be able to gain knowledge and start to apply that to a bigger primary healthcare setting. Um, it's important to look for ways to fundraise for local primary healthcare programs and services. Um, we know that government funding and certain grant funding only goes so far, but we also know that there's a willingness and a desire for individuals to give back to their community. And when you're purposeful and intentional in your fundraising efforts for primary healthcare programs and services, I have seen the success of that in supporting your own community. And just just the idea to start or partner with primary healthcare providers and stakeholders to listen and develop or support their vision goes a long way. I've heard, on a number of occasions from physicians and healthcare professionals and other healthcare primary care providers that they get really excited and encouraged when somebody comes to hear and support their vision. Oftentimes we come with the thought process of I'm coming to listen to respond versus listening to understand. And when we can do that, you gain a trusted partner, you gain a collaborative approach to this, and it may just mean spending a little bit of time asking the right questions and not necessarily seeking just to respond. There's a couple things here that I want to highlight on how, again, how you can be involved in from an advocacy perspective. Um, it is important to be educated and stay informed on primary healthcare topics, but it doesn't mean that you need to be the expert. You don't need to read, every press release that comes out. You don't need to read the Ministry of Health business plan from cover to cover. You don't need to initially, go out and seek to understand healthcare workforce data. These things are there for you um, to be informed, but it's more importantly there for you to ask good questions and to seek out individuals that you trust and that can help define some of this information in a way that makes sense for your community. It's very important, to seek opportunity to look for ways that you can become part of a focused primary healthcare group where they're looking at reform or initiatives, or you can even start to host some of those on your own. Um, it was a privilege for me to be able to go and spend time with some of the rural health advisory councils, some of the community recruitment and retention committees, and some of the community hospital foundations. It was a privilege for me to go and spend time and to seek to understand and to ask questions, but more importantly, to hopefully walk away with individuals knowing that I was a champion of what they were trying to achieve and that I was there to support them, and I was there to advocate with them when it was appropriate. Uh, and we've talked about volunteering and donating. And again, I want to stress that it doesn't necessarily sometimes mean a financial donation, but it may mean a time donation. Um, and I'll share a quick story again on something that maybe was a little bit non-traditional. I think many of you know the holiday train that identifies certain communities and comes through during the holiday season. The one year the train was coming through Hardisty, and so we took the time to say, hey, if anybody wants to volunteer and come to Killam, and we're going to spend some time, we're gonna share some hot chocolate, and we're gonna be in the community. The town was having sort of a little event, a festive event on their main street, and we were going to be part of that. And we had about 4 or 5 individual healthcare professionals step up, and community leaders step up, and we went out. And it was interesting for me to see in that type of an informal setting how much conversation and information and just general seeking of knowledge and was shared. And it was between the community and the providers. It was between leaders and other leaders and communities. But for me, even as a healthcare administrator, that time period of a drive where we spent an hour and a half in a vehicle together, where I essentially said nothing and I just listened, to have individual providers and others share with me, their concerns, what they liked, what they didn't. That was so significant for me. It was such a gift for me because it was done in a very trusted and loving way, and in a space that we were able to have conversation and then action some of that. And that is part of advocacy, is being relatable and showing empathy. So I do want to share some of that piece as well. And lastly, and it goes along on this thread. Don't be scared to speak up and share your story, right? It's important to look for opportunities to celebrate the successes, and share that importance of primary healthcare in your community and what it means to you. We did touch on this briefly, but I will say again, your local primary healthcare providers, they want to and they need to play a critical role in the advocacy space. encourage them to participate and look for ways to collaborate. I think, one of the best examples is our RhPAP's, skills event. We hosted one in Camrose. We had a fantastic day with municipal leaders and healthcare professionals and providers and stakeholders and students working and collaborating together, sharing information. But the best part of the day was we actually took them out to Round Hill to a small community event where, we shared food and fellowship and we danced and we shared stories and we sent them on their way later in the evening. And I think everybody was just so encouraged by the opportunity to share and particularly the physicians and the healthcare providers in themselves being able to be part of that was particularly inspiring. Next slide, please. So I'll just wrap up with a couple other slides and then we'll have some time for some conversation and questions. Again, just wanting to highlight some of the common barriers that we're facing. But the one thing that I will mention that I didn't put on this slide that has also been talked about is some of the patient information, the privacy, the data sharing. And I would encourage all of you to think a little bit about that in the sense of how can you advocate and how can you support some of the work and some of the work that still needs to happen in interoperability with data sharing and data information and sharing patient information where it's appropriate. There is a lot of discussion happening in the healthcare system now about taking down silos and interoperability and data information and sharing is one of those. And I mean, obviously AI is certainly with us and it does play an impact and a role in this as well. But it is one that I like to highlight with leaders such as yourself because it is an important piece of the healthcare system that we need to work on and we need to improve on in order for us to have better outcomes. So I'd like to kind of close on sort of a common conversation piece that we talk about around a healthy individual equals and a family equals a healthy community and a healthy economy. We can't, again, not put that fish on the table to say that there is an economic lens that we need to put on this work. And when we advocate for our community, we are advocating with that in mind. I'll end where I started, saying that there's not a start stop to advocacy. It has to be integrated into everything that we individually and collectively do, and how we make decisions and how we measure success. And so I do offer, some questions when I work with clients and we start to have these conversations. We don't need a large, a big, structured framework or plan, but we need to be willing to have these conversations in a trusted space and ask ourselves some of these questions with respect to our goals for advocacy. How do we embed it as part of our job description? And when I say job description, I don't mean formally in work, but just personally, right? How do we advocate personally? Talking about recruitment strategies when we are at a recruitment table for potentially recruiting, physicians and other healthcare and primary care providers. How do we want to make sure that that's sort of baked in, right? The advocacy piece is baked in. And lastly, how are we actively participating, right? Where are we now? Where can we be 6 months from now, a year from now, 3 years from now, when we're helping to advance our advocacy strategy? So I do want to wrap up and say that I always appreciate having these conversations about advocacy at the rural and remote primary care healthcare level. It is a passion of mine, and I do want to acknowledge and say thank you to each and every one of you for being leaders in your community, and seeking opportunity to be good advocates and good champions. And I certainly support you in that work, and I applaud you for the efforts that you put into it. So thank you again for giving me opportunity today to have this conversation.
Thank you so much, Stacey. That was an amazing presentation. I learned so much, even just with the difference with advocacy and lobbying, and how a lot of the advocacy really starts at the grassroots level. And I think that sometimes that's overshadowed by kind of, those bigger actions that a lot of individuals or groups or communities feel like they need to take in order to get their voices heard. And from what I was hearing from your presentation, a lot of it does start in the grassroots level. Um, and that local entity there. So thank you for the learnings today. And I'm going to put it forward to the audience. If you have any questions for Stacey, please feel free to put them in the chat. So my first question for you is, in your experience, what's the most common misconception that rural leaders have about advocacy in healthcare?
Thanks for that question. It's a good one. And we could spend a few hours talking about this as well. I will say that this misconception sometimes is something that we just put on ourselves in rural communities as rural leaders. Um, we don't give ourselves enough credit. And one of the things that I like to do and have conversation about is, again, celebrating the successes. I'm at a number of tables where these conversations about integration and collaboration and team-based care and holistic primary health care are talked about as some sort of foreign shiny object, right? That's unattainable. And what I keep reminding individuals at this table is, if you come to rural communities in Alberta, you will find multiple examples of this. We've been doing this, and we've been doing this well for a number of years. And that needs to be celebrated, it needs to be acknowledged, and it needs to be talked about, right? And so a lot of times it comes down to, let's have conversation about how we message this appropriately about all the good work that we do and leverage that into other work that we can start to do that will impact it even more.
And for those smaller and more rural and remote communities that are looking to advocate and maybe in their kind of advocacy, like at a higher level, what would you suggest they do to make their voices heard when they feel like they're being a bit overshadowed by those larger urban centers?
Yeah. So a thing that comes to mind for me, really resonates around having a collective voice. So having those conversations at the table first together, building consensus, developing some messaging, but the other piece that I'll share is, oftentimes it's so important to connect it to what government's mandate is, right? And there's numerous ways of, teasing out and pulling out information, whether it comes from the form of a ministerial business plan, whether it comes in the form of a press release on an initiative, whether it comes in the form of a premier's mandate letter to a minister, right? There's some key objectives and goals and items in there that oftentimes, if a community can come together, build consensus, have some consistent messaging, and then tie it to or align it with the government's mandate and actually uh, showing where that alignment is, right? Illustrating where that alignment is. It often resonates, right? And it often allows for that conversation now to happen because it's seen as you're showing that you're going to be a good partner at what government's priorities are, right?
Mhm. Yeah, that makes a lot of sense. And would you say, in terms of kind of those action items, there's more of a strength in a regional approach versus community specific?
It can be. It
Okay.
can be.
Hmm.
Yes.
Okay. Yeah. Thank you so much for answering those questions. That's great. I am not seeing. Oh, never mind. There's a note in the chat here. The concern that Emily has encountered is a fear of interfering with what our leaders are already doing and the fear of irritating our government and therefore losing any possible advantages. Do you have any insight into kind of tempering those fears?
Um, Yeah, and that's a really great comment. So thank you for that. Um, I think for me, what I've seen as sort of a roadmap to some positive outcomes is again sort of being strategic and understanding, you know, your community needs, building consensus at the community level first, coming with a collective voice, and then, you know, having that information or that evidence-based information from a government perspective of what they're being, you know, what they're saying, what they're asking for, what they want to achieve, often helps in those conversations where you do need to put the fish on the table and say, I heard this, I, you know, we heard this, we're talking about this, we think what you're wanting to do is this, help us understand and look for ways to be able to collaborate on that, right?
Mhm.
If that approach can happen in a trusted space, oftentimes those emotions come down a little bit, and the term I kind of like to use is often trying to just stay within facts versus feelings, right? It's not easy, but it's sometimes an approach that has to be taken in order to see movement or incremental success.
So thank you again, Stacey, for joining us today and sharing your valuable insight and experience and expertise into these topics. I know they're not easy ones to discuss, especially when you said there's no start and stop, right? It's an ongoing continuum. But I know that the groups that are, you know, really focused on this and really want better healthcare in rural settings will take, you know, the information that you shared today and run with it and implement it in your communities. And it was highly valuable. So thank you again.
Thank you.
Yeah.
Appreciate it.